Welcome to the webinar of Empowering Clinicians to Address Menopausal Weight Gain. My name is Catherine Mendez-Martinez. I'm a board certified family nurse practitioner, and I am so excited that you're here to learn on how to manage menopausal weight gain. We have a couple goals for this webinar. You're going to learn about the prevalence and importance of preventing weight gain during menopause, what the official definition of menopause is and the symptoms associated with it, all the hormonal changes that occur during this transition, the effects of menopause, weight gain on women's overall health, and you're going to learn a new innovative practical strategy called Namaste, which is an acronym on how to deal with menopausal weight gain in the primary care setting. The objective of this webinar is it's going to increase a clinician's knowledge, confidence, and improve practice behaviors related to counseling female patients on menopausal weight gain. So, first, why are we even doing this webinar? Why is this webinar even necessary? Well, studies show that weight gain occurs during menopause, but it's not commonly addressed in offices. In primary care, for sure, it's not being addressed. Patients are not bringing it up. Primary care clinicians are not bringing it up. The webinar aims to close the critical gap in routine care where weight management in menopausal women is often under prioritized. Healthcare providers just don't receive a lot of menopausal education beyond the basics. Gynecologists receive a little bit more information on how to deal with menopause, but primary care clinicians receive very little education on how to deal with menopause. This makes proper menopause management and discussions a privilege rather than a standard of care, and this evidence-based webinar will start the conversation. Let's get started. So, when do you know that your patient has started menopause? A woman is considered in menopause the day after 12 months without having a period. The average age of menopause is around usually 51 years of age. This can fluctuate woman to woman. Menopausal women make up a lot of our patients, so this is important for us to know. According to current statistics, by 2030, there'll be about 1.2 billion menopausal women in the entire world. So, what are the changes that start occurring in menopause? Well, there's a decline of estrogen, testosterone, thyroid, and progesterone production. The hormone, the hunger hormone, ghrelin, starts increasing during this period as well. It's primarily made in the stomach and stimulates appetite, signaling the brain to start eating. When it's high, it leads to increased hunger, caloric intake, and subsequent weight gain, especially in the abdominal area. So this going up really makes people eat more. Leptin also starts rising during this time. Leptin is considered the satiety hormone. This hormone tells the brain to reduce appetite, which causes a person to stop eating. During menopause, leptin levels rise, which sounds amazing, right? But unfortunately, menopausal women start developing leptin resistance, so reduces its effectiveness and contributes to weight gain. There's a lot of changes in body composition. A lot of the weight goes from the hip and the thighs all into the abdominal area, which is this belly fat or visceral fat. This is adipose tissue surrounding vital organs that usually to a degree is good, but when it's in excess, it can lead to a lot of health concerns. This is not enough. Menopausal women also start reducing muscle mass by a rate of 0.6% per year. This increases more body fat, alters fat distribution pattern, reduces bone mineral density, lowers metabolic rates, and then this can lead to something called sarcopenia, which is when you increase fat and decrease muscle mass in women. Menopause has a lot of symptoms associated with it. There's at least 35 symptoms or more associated with menopause. Some include mood swings, hot flashes, brain fog, sleep disturbances, anxiety, loss of libido, joint pains. But another major symptom is fatigue. Women are more fatigued during menopause. So they have a tendency to have less energy to do the physical activity that's needed to prevent weight gain. Is this a surprise then that the statistics show 60 to 70% of menopausal women gain weight during this period? So is this just a cosmetic issue? Should we not really be concerned? It's just that their jeans get a little tighter in the abdominal area? No, this is a concern because the weight gain can cause several health concerns and health diseases, including hyperlipidemia, heart disease, type 2 diabetes, breast cancer, metabolic syndrome. These are just to name a few. There are several health concerns that go up when these abdominal weight gain and this increased weight gain occurs. Even this weight gain is associated with anxiety and depression. Studies have shown that menopausal women frequently face body image and self-esteem challenges due to all these hormonal changes. So what is the current menopausal weight gain protocol? What are we currently doing in our primary care settings to address the weight gain? Well, we're basically telling them eat less, exercise more, which is the standard for every patient that we see that says that they have gained some weight. We tell them eat less, exercise more. So often women are told just to basically accept that weight gain occurs with menopause, and that's just something they have to accept. The truth is, this is not really being addressed in the offices. We already mentioned a lot of times nobody's mentioning the weight gain. But on top of that, a lot of insurance companies don't even cover menopause related visits or treatment plans. It's often bare and really inconsistent. So a lot of times there's a lot of things that are not really being addressed when it comes to the weight gain in menopause. So what are the solutions? Currently, menopausal symptoms are being managed by antidepressant and hormone replacement therapy. Now, weight gain, we have the GLP-1s that are very popular. So why don't we just prescribe everyone this? The truth is, we can't. There's a lot of side effects and costs associated with these medications. Some patients cannot tolerate it. There's some side effects that really are unpleasant with these medications. So, what can we do with these patients? We can offer them evidence-based lifestyle changes. So, there's a practical toolkit that now exists that can assist you in remembering all the evidence-based lifestyle changes that you can recommend to your patients. I introduce you the Namaste acronym. Namaste stands for nighttime routine, alcohol reduction, Mediterranean diet, adequate water, salt and stress reduction, tea integration, and exercise. So, why Namaste? Why is that word Namaste even being used? Well, it's a traditional Indian greeting. Usually, it's used after yoga or meditation practices. It usually is used to enhance emotional balance, relaxation, and inner peace. The acronym was used to symbolize the peace and supportive transition through all the changes that occur during menopause that we want to really transmit to our patients, even when dealing with the weight gain that occurs with menopause. So let's start with nighttime routine. There's a definitive major sleep-weight connection. Studies have proven that hormonal changes affect the quality and the quantity of sleep during menopause. Lack of sleep increases the hormone cortisol, and increased cortisol levels causes more insomnia. The cycle goes over and over and over again. This disrupted circadian rhythm and poor sleep quality affect fat metabolism and appetite regulation. Irregular eating time impairs liver function and fat digestion. Lack of sleep increases the hunger hormones we mentioned previously, leptin and ghrelin. It reduces insulin sensitivity, boosts cravings for high fat and sugary foods, and lowers motivation for physical activity for the next day. So it matters to ask these patients, how are they sleeping? Studies show that improved sleep hygiene reduces menopausal symptoms and aids weight management. Establish a consistent sleep schedule. Tell your patients to establish one. Tell them try to go to sleep between 10 and 11 p.m. if possible. Tell them if they are not sleepy, try to take sleepy time tea or over the counter melatonin. Tell them to stop news 2 hours before or any of those exciting shows or any stimulating news 2 hours before. Tell them to create an optimal sleep environment. Nice and cold environments have proven to help sleep. Also, tell them to try to reduce alcohol because there's a definitive alcohol connection with sleep disruption. This brings up the alcohol reduction part of Namaste. Alcohol is sleep disruptive and causes daytime fatigue, which menopausal women already have. Excessive alcohol is linked to increased abdominal obesity. It affects cortisol levels and insulin sensitivity again. Even worse, alcohol is high in calories, just empty calories a lot of times, and it lacks a lot of essential nutrients. It slows metabolism, increases appetite, which contributes to more weight gain. Alcohol can trigger and worsen hot flashes and night sweats, making an already uncomfortable situation of menopause to an even more challenging time. So ask our patients about usage. Our menopausal patients are drinking more. Hormonal fluctuations during the menopausal transition, such as changes in estradiol and testosterone, can impact food regulation and stress responses, making alcohol an appealing coping mechanism for many menopausal women. So tell them to reduce significantly the alcohol or stop it altogether to really reduce the weight gain. Encourage them to also implement the Mediterranean diet. Here comes the M in Namaste. So many diets are out there. So why would we implement the Mediterranean diet in particular for menopausal women? The Mediterranean diet has been proven to improve weight, significantly reduces central obesity, reduces menopausal symptoms, and enhances mental health. And it focuses on cardiovascular health and the reduction of inflammation. It encourages mindful, slower meals, social dining, and enhancing satiety and portion control. It encourages increasing fiber, clean protein, and good fats. So let's encourage our patients to implement these Mediterranean principles in their diet. Tell them to eat the fruits, the vegetables, the whole grain, nuts, legumes, olive oil, good quality of olive oil. Tell them to limit the red meat, the processed foods, and decrease sugar. Tell them to aim of 20 grams or less of sugar. Reduce, obviously, all that processed food is going to help the inflammation around the abdomen that the menopausal women complain so much about. The Mediterranean diet also increases fat and fish and seafood in their diet. So the Mediterranean diet really focuses on fish and seafood, which is rich in monosaturated fat and antioxidants. Also, encourage our menopausal women to drink enough water. Here comes the A, which adequate water. Hydration and sodium regulation are essential, yet often overlooked in managing menopausal weight gain. The general recommendation is 2.7 liters or 91 ounces of water per day per woman. This can change depending on the average weight on the woman. Increased hydration helps reduce hot flashes, supports metabolic function during menopause. Adequate hydration supports metabolism, reduces hunger, and aids fat loss, like I just previously mentioned. It increases the increased water intake associated with weight loss and lower BMI. Drinking water before meals also makes you feel fuller faster. So, how about reducing salt? S, salt and stress reduction benefits. The excess sodium is linked to fluid retention, increased body weight, and hypertension. Hormonal shifts in menopause increase water retention and fat storage, particularly in the abdominal obesity area, and the whole abdominal area, increasing abdominal obesity. Lower salt intake reduces fluid retention, abdominal bloating, and aids in weight loss efforts. So tell them to reduce the salt in their foods. Tell them if they're eating out, tell them to hold the salt or tell them to reduce the salt. Let them explore herbs and spices as salt substitutes, limiting the processed foods. Anything that's microwavable that comes in a box is processed. Tell them, encourage them. Ideally, it should be less than 1,500 milligrams a day of salt for optimal cardiovascular and metabolic health. The aim is 1,500 milligrams. At least tell them to at least strive for at least less than 2,300 milligrams. But for optimal health, it should be around 1,500 milligrams a day. This comes straight from the American Heart Association. The S in stress reduction. Stress increases cortisol production. Remember, elevated cortisol promotes visceral fat storage, insulin resistance, and disrupted appetite regulation. Menopausal women are especially vulnerable due to the concurrent hormonal changes that occur. So encourage your patients in the office to build strong social connections to help them significantly reduce stress and hope and improve coping mechanisms. Tell them to join support groups, maintain regular interactions with family and friends. Don't be afraid to refer to therapists and even refer them to do meditation and breathing techniques. They can tell them, look up online. They can find videos to help them breathe, really help them reduce that stress, to help them reduce and prevent the weight gain. Then I want them to we want them to start including tea into their diets. Why tea? Try to encourage switching from caffeinated beverages to tea. Let's be clear. Coffee is not a problem. The added sugars in coffee is a problem. Moderate coffee consumption without added sugars can actually support weight management in studies, whereas sweetened coffee may contribute to weight gain. Regular tea consumption is associated with decreased body fat and improved metabolic markers. For example, let's compare tea to a coffee house coffee. Let's take the famous Starbucks Grande Ice White Chocolate Mocha. This is straight from their website. It has 42 grams of sugar, okay? And this is compared to a brewed tea, which can have around 2 calories and about 0 grams sugar if you don't add any sugar to it. The American Heart Association recommends limiting the daily intake of sugar to about 25 grams, which is 6 teaspoons or approximately 100 calories for women. So one grande Starbucks coffee can already you have already the sugar intake for the day. So encourage your patients to reduce the coffee they buy from coffee houses. And if they're going to a coffee house, tell them to ask for tea. Advise our patients to have less caffeine. Excess caffeine increases cortisol, promotes abdominal fat, and disrupts sleep. This tip is really good for reducing and replacing sugary and caffeine drinks. So, what are the benefits of tea? It has metabolic effects, hydration benefits, and calming properties. Those patients that say, I can't get the amount of water you just told us that we need to have, tell them to put a tea bag in their water. It'll give it a little flavor without any sugar. There are some great beneficial teas you can encourage patients to have. Green tea, black tea, these increase metabolism and aid in weight loss. It reduces cardiovascular risk. Black tea has actually been shown to improve insulin sensitivity and reduce diabetes risk. There's a lot of benefits. White tea has high antioxidant levels, including among really teas, promotes weight loss, cardiovascular protection, improves skin health. Oolong tea or oolong tea enhances fat burning, improves cholesterol profile, and is beneficial for weight loss. There's a lot of benefits to tea. And then when it comes to calming and that stress reduction, that S in Namaste, chamomile tea reduces inflammation, aids sleep quality, lowers anxiety, beneficial also for mental health. Peppermint tea after a meal aids digestion, reduces bloating, supports GI health, potentially assisting weight management as well. So encourage our patients to try to bring more teas in their life. Now, last part of Namaste, the E, exercise. We all know we need to exercise to lose weight, but what about specific weight gain in menopausal women? Let's focus on strong versus skinny. No longer is it just about exercising to be thin. Exercise alone supports good bone and joint health, produces endorphins, the feel good hormones, promotes good sleep, and supports good lean body mass to fat, visceral fat mass ratios. So, exercise is always encouraged. Circuit training and aerobic exercises are beneficial for reducing abdominal fat and improving body composition. But we want them to focus on resistance training. So it's not just about vigorous cardiovascular exercise. The hours on the treadmill is not where we're focusing our menopausal women. So, what is resistance training? It's known also as strength training or weight training. It's a form of exercise that involves working against a force to build muscle strength, endurance, and power. This force can come from free weights, resistance bands, weight machines, or even body weight exercises. The primary goal of resistance training is to challenge the muscles, causing them to adapt and grow stronger over time. Resistance training in menopausal women has a lot of benefits. It prevents muscle loss. We already mentioned how much muscle loss occurs in menopausal women. Resistance training prevents loss of lean muscle mass, which is essential during menopause. It strengthens bones, improving bone density. It boosts metabolism, enhances functional independence, reduces anxiety and depression that we already know menopausal women sometimes suffer from, and improves mood and self esteem. Let's encourage our patients to do around 2 to 3 times weekly of resistance training. Try to tell them to do it non-consecutive days. Perform exercises at moderate to high intensity, starting to 8 to 12 repetitions per exercise set. Complete about 2 to 4 sets per exercise. Gradually encourage them to increase resistance or repetitions to challenge muscles and to promote adaptation continually. Some examples that we can tell them to do some squats, deadlifts. We can tell them to use some resistance bands, to do some rows, push-ups, and lunges. All of these are examples of resistance trainings we can tell our patients to start integrating into their workout routines. So tell them, get a trainer or look online if they need instruction how to properly do resistance training to avoid injury, of course. And the equipment should be used for progressive increase in weight. Let them know, increase weight little by little, okay? That's going to help them build more muscle. You can't do the same exercise all the time and expect the same results. So I hope that you already learned a lot of things on how to deal with menopausal weight gain in your patients. I hope you learned on how hormones influence weight, how to pay attention to weight gain in menopausal women. Remember to always address these weight gain issues in a sensitive manner, but address them. And now you know how to introduce and educate patients to Namaste, the acronym. And make sure to schedule follow ups to see if they're implementing the tools of Namaste. Are they increasing their nighttime routines? Are they improving it? Are they reducing the alcohol? Are they implementing the Mediterranean diet? Are they really getting adequate water? Are they reducing their stress and their salt? Are they trying to change their Cokes and their sodas and their coffee with teas? And are they doing resist training exercises? Thank you so much for listening to the webinar. Please use the QR code here to have the Namaste handout to give to your patients. You can have them either scan it so you can print out the QR code or print out the actual printout and have it readily available for your patients. Thank you so much for listening. If you have any questions whatsoever, please email me here and I will make sure to answer. You will be receiving an email in 1 to 2 weeks on a post survey for this webinar, letting me know if you learned anything, if you increased your confidence in dealing with weight gain during menopause, and if you have changed any practice in your office with the Namaste protocol. Thank you so much and have a beautiful evening.